Colorectal cancer is eminently treatable so long as we catch it early. That's what all the data tells us. GPs are doing an excellent job at picking out the appropriate patients and setting them up on the right pathway. But there's data from Bowel Cancer UK that says that 20% of patients diagnosed with colorectal cancer have seen their GP on 3 or more occasions with the same set of symptoms. So there is a subset of patients out there who aren't being referred early enough.
The NICE guidance was updated in 2015 and gave really strong instruction for GPs about who to refer for cancer or not to the hospital. 2-week wait referrals are those referrals where you are pretty sure there is some symptom from the NICE guidance that would highlight that cancer would be a possibility. Then there is no question that a patient must be sent on the 2-week wait pathway.
Usually on the colorectal pathway it'll be a colonoscopy. And if we're given the wrong information at the start, then they may well end up having the wrong investigation, and that consumes resources as well as delaying the period before we can make a definitive diagnosis.
We really want good feedback from our 2-week wait forms so that we can do them better and make patient experience better for the future. Doing a 2-week wait referral, you need to consider examining the patient, and that examination will totally depend on the patient's symptoms and the type of referral you're going to do. If they've got symptoms that make you think of doing a lower gastrointestinal referral, you would probably do a full abdominal examination and also a rectal examination if the patient consents to that. Think about relevant blood tests as well, so a full blood count, iron studies, and a celiac screen would be useful as well. You fill out the demographic details. They then need to put the clinical information. It's really important to record the information clearly on the 2-week wait form. The way of doing that is to tick the relevant boxes of the clinical symptoms that are aligned with NICE guidance, but also to put some information into the free text box. In the free text box, you can put whatever you think is relevant. Family history of cancer, how long they've had the symptoms or what those symptoms are, or what the GP's thinking might be the diagnosis, because often the GP's got to know that patient over time and can give some really good insights. They can pull up a leaflet to print out that's really helpful so the patient's fully informed. They then need to send off that form. That could either be by an email. They can find the email for the right hospital at the very top of the form. Faxing is not a good idea. In the past, faxing was used, but it was best if they use an electronic way, so either email or the e-referral.
When the GP sends a referral in, there's a team of administrators in the 2-week wait office, and they sort out all the necessary admin behind the referral, so they'll arrange the appointment, make sure the patient's logged onto the system and so on. Then within 2 weeks, they'll see a doctor in clinic, and then that doctor in clinic will normally arrange some sort of investigation.
If we understand why a patient has had a certain test and we need to look out for a result, for example, we're going to be able to allay their fears better. We're going to make sure that they get sent for future tests appropriately, or that they see the right doctor next.
There are massive issues with endoscopy capacity and demand. But I always say to GPs, that's my problem, let me worry about that. But you have to make those referrals, it's really important.